Hello everyone, welcome back to ProstheHub. Myself Dr. Jolsna, and this is the final session of our current topic, balanced occlusion. So, till the previous session we have discussed the factors influencing balanced occlusion, and the next topic to be discussed is how to achieve balanced occlusion. So before getting into the topic, I request everyone to please do like and share my videos, and if you are new to this channel ProstheHub, please do subscribe and support me. And if you have any queries or any topic that needs to be discussed, do comment below this video or you can mail me at this mail ID. So let's start. So first of all, let us see the different steps in the fabrication of a complete denture with balancing. So the first step is the primary impression using the impression compound, then the border molding using green stick, and the secondary impression made with zinc oxide, and then jaw relation, the face bow transfer and mounting onto the articulator, then the attachment of tracers, and then the extraoral tracing, and then the protrusive as well as the centric interocclusal record is made, and then the condyle guidance angle are set. Next is the teeth setting. First the maxillary as well as the mandibular anteriors are set, and then balancing has been done with the proper aesthetics and phonetics of the patient. Then the mandibular as well as the maxillary posteriors are set and balancing has been done. And once this is completed, you have to do the trial, and then denture is fabricated. You have to do the lab remount and do the occlusal adjustment so that the balancing is accurately replicated in the patient's mouth. Thus, we will be able to deliver a completely stable denture to the patient which is having improved masticatory ability. Next, I will discuss briefly balancing of the anterior teeth and the posterior teeth. So before starting with balancing, we have to take care of certain things. That is, the first one is basic principles of teeth arrangement has to be followed. So once you follow these basic principles, it will give the required compensating curves to the entire teeth arrangement, and once you set the teeth according to the compensating curves, it will make easier for us to achieve the desired balance with little modifications to the cuspal inclines. And it is also important to keep the semi-adjustable articulator in its recommended baseline settings during the teeth setting procedure, and to ensure that they follow and maintain the level of the established occlusal plane, we can use a small glass tile in order to help the positioning of the teeth to this occlusal plane. And also remember to avoid mutilating the occlusal surface of the wax rim unnecessarily. So let's start with balancing the anterior teeth. So we know that the anterior teeth setting must fulfill physiologic and functional requirements of individual patient. That is, the teeth are set based on the aesthetics and phonetic requirements of each and every patient. And based on this aesthetic and phonetics, the incisal guide table angulation is also adjusted. Now, this can be checked during the anterior wax drying. And the first step before starting with balancing is to ensure that the teeth are arranged properly in their centric relation position. And once this is ensured, then we have to proceed to obtain balanced contact during protrusive movement as well as lateral movement. So in order to obtain protrusive balance, first loosen the centric lock nuts. Next, you have to move the flat end of the incisal pin on the central track of the incisal table posteriorly. Now remember that our articulator has got the movable part, that is the upper member. So we have to move the upper member backward in order to bring the upper anterior teeth in edge to edge relationship with that of the lower anteriors. Now ensure that pin is moved for a minimum of 5 to 6 mm of the protrusive distance on the guide table to be of any significance. So less than this will not be useful. So you have to move at least 5 to 6 mm. And once you get the protrusive balance, that is, all the maxillary and mandibular anterior teeth should come in edge to edge contact at the final protrusive position. So if they are not, then you can adjust it by removing the wax or trimming or thinning out of the denture base or the ridge lap area of the denture teeth, or by minor tooth positional correction. So this is protrusive balance. Next is achieving lateral balance, which is done separately for each lateral side. So remember that our articulator's upper member is the movable one. So if you move the upper member to the right, that means right side is actually the non-working side and left side is the working side, which is actually the reverse situation in the mouth. So if you move the mandible to the left side in the mouth, the left side is the working side. Whereas in articulator, if you move the upper member to the right side is the non-working side. So now move the incisal pin to one side of the incisal table along the raised lateral wing and check the edge relationship to the on the left side, which is the working side, and ensure that there are contacts between the working side laterals and canines without encountering any pin raise. If there is any pin raise, you have to adjust it. We have already mentioned how you have to adjust it, and you have to achieve the desired centric gliding relationship and lateral edge to edge working side contact without pin raise or tooth movement in the wax. And then repeat the same procedure on the other side, and once the lateral balance is achieved, you have to seal the teeth properly in their position. So once the balancing of anterior teeth is done, you have to proceed with balancing posterior teeth. So first you have to set the posterior teeth, and there are two approaches of arranging posterior teeth. Some advocate that arrangement of mandibular posterior teeth should be done first, following the anatomic guidelines, and then you have to arrange the maxillary posterior, whereas others prefer to arrange maxillary posteriors according to the glass plate relationship and then proceed with establishing the key of occlusion, that is with the mandibular first molar, and then completing the arrangement of the other mandibular posterior teeth. So whichever arch you are giving preference is not important, but it is more important to bear in mind about the leverage forces and denture stability. That should be given more preference. So once you set the maxillary as well as the mandibular posterior teeth, in order to obtain the maximum intercuspation at the recorded centric relation, then you have to try achieving balancing in both protrusive as well as lateral excursions. So in order to obtain the protrusive balance, like we have already said, first the centric lock nuts are loosened and incisal pin is moved posteriorly. So in the protrusive position, all the maxillary and the mandibular posterior teeth should come in cusp to cusp contact. So the teeth should be in maximum intercuspation during centric relation and should exhibit balancing anterior and posterior tooth contact without any incisal pin raise. However, when more number of balancing tooth contact is difficult to accomplish, at least ensure a minimum of 1 anterior and 2 posterior, that is tripodization, in order to ensure stability. Now, if there is an incisal pin raise, you have to correct it either by a repositioning of the tooth or thinning out of the denture base or trimming of the ridge lap area of the denture teeth. So, while doing this procedure, take care not to alter the vertical relationship between the opposing teeth. So while doing the modification, you have to find out the occlusal interferences using an articulating paper and use a small mounted acrylic stone to remove these interferences. And remember, no trimming or reduction of the centric holding cusp. Only you have to carry out modification on the corresponding opposing non-functional cusp. Again, the slopes should be adjusted, not the cusp tips. The cusp tips, if you adjust, it will affect the vertical relationship again. So you have to make modification on the slopes. So this will not only maintain the vertical height, but also it will help to help the opposing cusp to occlude properly into each other, thereby maintaining their centric relationship. So this is how you are achieving the protrusive balance. Finally, coming to achieving the lateral balance. So here, check for presence of both working side as well as non-working, that is the balancing side contacts during lateral excursive movement. So we know that when we move the articulator to the upper member to the right, it means that the left side is the working side and the right side is the non-working side. So you have to check for contacts on both the working side as well as non-working side. And the non-working side contacts during lateral excursions are important because these will prevent tipping of the denture during this movement. And after completion of the setup, check all the relation in the centric occlusion, working as well as balancing contacts, and such arrangement will enhance the stability of the denture and hence will provide more comfort to the patient. So this is how we achieve balancing in a complete denture. Next, let us see about the arrangement of teeth and balancing the occlusion in class 2 and class 3 relation. So in class 2 ridge relation, you have to select the lower anteriors with a narrow mesiodistal width in order to achieve the normal canine relationship. Or if the aesthetics permit, a little crowding of the lower anterior teeth is also acceptable, and you can also provide slight spacing between the upper anterior teeth to attain this normal canine relationship. And if the discrepancy is more, you can eliminate setting the lower first premolar. And about the posteriors, upper posteriors are placed slightly palatally in order to provide a working occlusal contact with the lower teeth, and the lower posterior teeth are placed over the crest of the ridge. And there is a large buccal horizontal overlap in the first premolar area. So in that case, the lingual custip or the palatal custip of the upper and the buccal custip of the lower first premolar is flattened to a horizontal table in order to provide a stable centric contact. So in such cases, you can use the non-anatomic teeth and set in the Plesher curve or the reverse lateral curve. The Plesher curve by Dr. Max Plesher we have already discussed in our session 1 of this topic. Now in class 3 jaw relation, if the ridges are in edge to edge relation, you can go for anteriors also to be placed in edge to edge relationship. And if there is extreme protrusion of the mandible, a negative or a reverse horizontal labial overlap can be used. And here you have to select larger tooth mold in case of lowers in order to compensate for the wider lower arch width. And also an extra lower incisor can also be included in order to avoid the spaces between the lower anterior teeth. If aesthetics permits, crowding can be done in case of upper anteriors. Now the class 2 prognathic relationship, the lower arch is far more buccally placed. So in order to control the tipping forces on the upper denture base, teeth can be set in cross bite relation. And in case of wide lower arch, an interchange can be done by using upper teeth on the lower denture and lower teeth on the upper denture. So in such cases, non-anatomic teeth is indicated, because with this type of teeth, buccolingual and mesiodistal relation is not as critical. So these cuspless teeth will allow freedom of the buccolingual placement and also provide occlusal contact in the upper and the lower teeth. Now finally, to summarize and conclude, the introduction of concept of balanced occlusion has been a single largest step towards the development of physiologic complete dentures. So we know that balance means whenever a force acts on the body, there should be no motion. That means there is balance or equilibrium. So achieving balance should be the primary concern of a dentist when considering the forces that act on the teeth as well as the denture base. So our ultimate goal should be to have a stable denture base, and total stability is not possible because of the yielding nature of the supporting structures, but we can control the physical factors that influence the positioning of the teeth in the denture base in relation to the ridge. So balanced occlusion is one of the most important factors which favor the stability of the base and helps in preservation of the supporting structures by reducing the lateral forces. Now these are my references for this topic. And thank you all for watching my video. Please do like and share my videos if you're finding them useful. And if you're new to this channel Prosthesis Hub, please do subscribe and support me. And if you have any queries or any topic that needs to be discussed, please do comment below this video, or you can mail me at this mail ID. So until our next topic, it's bye from Prosthesis Hub.